Hi, I'm Dr. Steve Ranicki with Ranicki Chiropractic. I wanted to talk to you for a moment about torticollis. Torticollis is a condition where the neck won't rotate equally well in both directions and doesn't always have to, but very typically comes also with some head tilt like this. Torticollis predominantly affects children. It certainly can happen in adults as well, but it does much more affect children. And the traditional thought process has always been that there's a muscle imbalance and that the muscles are tightening and spasming on one side, pulling the head in that direction. However, there's another perspective that I want to share with you that most doctors are not aware of, and that this could actually be coming as part of a problem in the balance centers inside the inner ear, the vestibular system. So inside of each of our inner ears, we've got these three semicircular canals. So two of them are arranged like this, two of them sit like this, and two of them sit like this. And those help the brain to sense any movement happening in any rotational type of direction. But sometimes either those semicircular canals or the nerves going from them to the brain are not working quite correctly, and the brain can misperceive that there's movement happening that's not really happening. And as a result, the brain may say, okay, then because it feels like I'm constantly falling this way, I'm going to try to cancel that out by tilting the head in the other direction. This is not necessarily the cause of every case of torticollis, but it is a situation that happens a lot more, I think, than is realized and acknowledged, and it is something that most pediatricians wouldn't be tending to look for. But here at Ranicki Chiropractic, we have a specialization in something called functional neurology, and that is a way of assessing and measuring the function of all the different levels of our nervous system. Everything from the receptor, which is what those semicircular canals would be, all the way up to the cortex. And we can find out if there is one particular side of or level of the nervous system that isn't working quite as well as the other, and then put the right kind of neurologic stimulus and input in that helps to rehabilitate that part of the nervous system to get the brain back to be able to perceive where the body really is at in space and what the appropriate posture would be and what the appropriate muscle tone would be to get it there. So I just wanted to share this other different perspective. Certainly, torticollis can also come out of things like misalignments in the bones of the spine. It certainly can come out of muscles that are spasming, but you gotta remember, a muscle only does what it's being told to do. A muscle doesn't decide to spasm just all on its own. It's typically it's either trying to block and prevent a movement that would create injury, or trying to create a movement that would improve or fix something. So addressing it just simply by dealing with it as a muscle-only problem, either by using a muscle relaxer that's injected directly in the muscle, or doing a lot of stretching the muscle, or I've seen even cases where they've gone and actually cut the muscle, it's not really getting to the real cause of that issue, and there's generally much safer, much simpler, and I would argue more effective ways of handling that problem. So if you know someone that's dealing with torticollis, we certainly love to see what we can do to help them out with that. If you want any more information, just reach out to us here at Ranicki Chiropractic. Thanks so much.